Good morning. Once again, today's show focuses on healthcare because it seems to be that is what Congress is focusing on. Now, back when Obamacare was being talked about by the Democrats, the Republicans were bitching and moaning that it was done in secret, that nobody knew what this plan was really about until basically it was passed against the Republicans' wishes. Well, now the Republicans apparently are doing the same thing. They are holding secret meetings trying to pass a health care plan that will affect every single one of us, and nobody knows anything about it, except the Republicans who are in the meetings. Look, the bottom line is health care has been an issue. It's been a campaign issue. It's been promises made and promises broken by almost every candidate for president and every congressional and Senate candidate in the past 25 years. And I think we need to almost go back a little bit. What healthcare used to be. I started working full-time in 1985. And back then, anybody who had a full-time job received health insurance through their employer. Every week, a certain amount of money, very little if you think about what healthcare costs today. My first job, I paid $11 a week for health insurance with a $100 per year deductible. Can you imagine? Now, it wasn't bells and whistles. It wasn't free pap smears. It wasn't free birth control. It wasn't free colonoscopies. It was a $100 deductible and then an 80-20 to a certain amount. And once you paid out of pocket to a certain amount, it was 100% covered. And just like today, when people are charging $700 and something a month for health care for one person with a $7,000 per year deductible, I don't know. I don't know. I did have to pay for prescription drugs. I had to pay back then. I paid about $20 a month for birth control pills. $20 a month. Today, those same birth control pills, while free under Obamacare, would cost somebody without insurance probably $200 and something a month. It is ridiculous how things have gone up since I started back when I was a youngster, starting out in my first full-time job. The bottom line is, anyone who worked full-time back then could get affordable, and it was affordable, health insurance through their employer. And today, that is just not the case. Obamacare, I was all for it on paper. But what happened was, and this is the only thing that Donald Trump and I agree on, is Obamacare was mostly lies. The only thing Obamacare did that it said it was going to do was it stopped those lifetime caps, and that is important. What would happen is someone like myself, who has never filed a significant claim with any health insurance company I've ever had, would basically pay premiums all of my life, and that 1 year, when I have that really serious illness, you can reach your lifetime cap in a month or 2 months or a year of fighting a serious illness. And if you meet that cap, guess what? No insurance company would touch you. That was the best of Obamacare. It got rid of the lifetime caps. No insurance company could say, well, when you reach this amount, we're done and you're on your own. That's the only good thing that came out of Obamacare. Everything else was a lie. You can keep your own doctor. You can keep your insurance plan if you like it. Well, we liked one of the insurance plans we had, and the insurance company picked up their toys and went away. They canceled us, even though we had never, ever cost them one dime of their money. We just kept paying them, never cost them a dime, and they canceled on us. They said, you know what? We're losing too much money on this plan, we're canceling it. But we'll sell you one that's 10 times more expensive, and you can keep all the benefits you have now. What benefits? We never used them. So that part was a lie. You cannot keep your health insurance under Obamacare, even if you like it, because the insurance companies are, again, even though Obamacare was supposed to reel in the insurance companies and give the consumer control, the insurance companies still control everything. The one insurance plan my husband and I got the 1 year, and this is interesting because of where we live, in Lancaster, Pennsylvania. In Lancaster, Pennsylvania, there is one hospital group that has a monopoly. Most of your family doctors, most of your surgeons, most of everything is owned by this one hospital. It's called Lancaster General Hospital. And they own everything. And most doctors in Lancaster practice under General Hospital. Well, 1 year, my husband and I were looking for an affordable plan, and we found one. And we found one that said you can't use Lancaster General Hospital. Now, my husband and I were lucky because Lancaster General Hospital happens to be the hospital that murdered my mother through malpractice. So we always go to doctors that don't practice at LGH. We don't want to go to LGH. So therefore, when this insurance plan came up that was very affordable, $500 a month for both of us, with I think a $5,500 a year deductible with both of us. That means we would each, once both of us, and there was anything either of us did combined, went to that deductible. That was a good plan. But we could only go to Lancaster Regional Health, which is actually the hospital we wanted to go to anyway. So my husband took that plan, but it perplexed us because Lancaster General is actually a not-for-profit hospital and Regional is a for-profit hospital. And yet this insurance company said you can only go to the for-profit hospital, which is kind of weird. But anyway, because the for-profit hospital, of course, is a little more expensive. But we were happy with that. But then that insurance picked up their toys and went home. And we were stuck again. So that was all a lie. When Obama came out and said you can keep your doctor and you can keep your plan if you like it, that was all a lie. Because the plan went away. And then, I mean, think of somebody who only goes to a Lancaster General Hospital doctor. Well, if they wanted the plan that we had, which I thought was actually a decent plan for a decent price, with a not so out of reach deductible, if you had an LGH doctor, you would have to give up your doctor. So when Obama said you can keep your doctor, that was a lie too. Some doctors are saying Obamacare is screwing us, so we're not accepting anybody who's on Obamacare. Hell, some people aren't even accepting Medicare patients anymore because Medicare isn't paying. And I keep asking myself, how the hell did we get here? From back when anyone who had a full-time job got insurance through their employer, affordable, for one person, 11, 12, maybe 20 bucks a week out of your paycheck, you barely even missed it. $100 deductible, $200 deductible, no big deal. A family of four could get health insurance for $50 a week out of the breadwinner's paycheck. 50 bucks a week, 200 bucks a month for a family of four. And they didn't ask any questions about pre-existing conditions either. If I worked for A and B company and I had cancer a year ago and I just started working for them, I didn't have to say that. If I worked for that company, I was on their insurance plan after my probation period was over. No questions asked. No extra premiums because I had been sick before, I had a sinus infection a year ago, or whatever. They never asked. They didn't care if you smoked. They didn't care if you drank. Now, Obamacare doesn't care if you drink. They don't care if you weigh 700 pounds. They don't ask those questions. They don't care if you've had cancer. They don't care if you have high cholesterol or diabetes. But they sure as hell do care if you smoke cigarettes. That's the only question they're allowed to ask. Remember when Obama came out? Another lie. They can't ask you any lifestyle or health questions. Well, you know what? Yeah, they can. First of all, they ask you your birth date, which means they can punish you for your age. And second, they ask you if you use tobacco products, and they're allowed to do it. So this no lifestyle questions, everybody's accepted, nobody's going to be charged more for their lifestyle was also a lie. And I can prove that because my husband, who actually has health issues or had health issues till he lost 40 pounds, he was obese under insurance company standards. He had high cholesterol. He was borderline diabetic. And he was being charged $300 a month less, $3,000 a year less than I was, simply because I smoke cigarettes. I have never had any bad blood tests. I've never had any ill visit to a doctor in 35 years. Never gone to the doctor because I was sick. I only go for my routine exams. And yet I'm being charged more for two reasons. I'm 5 years older than my husband, and I smoke legal cigarettes, a legal tobacco product. So everything else about Obamacare, about that, you can't ask health lifestyle questions and you can't punish someone for being sick. That was a lie. Because they're not punishing me, by the way, for being sick. They're punishing me simply because I smoke a legal product and I'm 52 years old, I might get sick. And see, that's what Obamacare was supposed to stop. That you can't, just like you can't charge someone with a crime before they commit it, you shouldn't be able, as an insurance company, to charge someone for an illness they don't have and probably may never get from their past history. So there you go. Obamacare was a lie. But again, how did we get here? And why is it that for everybody who screams and rants and raves about the state of health insurance in our country, how is it that when we look at these other countries who have health care as a right, you're born in England, you're born in Canada, you're born in France, you're born in Germany, you get health care with no cost to you, no deductible. You just go to the doctor and say, here's my birth card. I'm a German citizen, I'm a British citizen, I'm a Canadian citizen, and you don't get a bill. Every country, even some third world countries, Cuba, Jamaica, China, they all have it. But Americans fight it. And yet, on the other side, when they're talking out the other side of their mouth, Americans continue to bitch about the cost of healthcare in America. We don't want the government involved in healthcare. We don't want all this, we don't think we should have to pay so someone else can have healthcare. And I agree with that. I don't think I should have to pay for someone who has 5 or 6 kids to have better healthcare than I have because they don't have enough money to pay for it themselves. And they're getting subsidies that I pay for. And my husband and I can't afford good insurance. In fact, I have no insurance at all because I'm not paying anybody $700 a month with a $7,500 deductible, because that's basically telling me I'm throwing my money away. It's already half a year since I've been uninsured. Do you really think that between now and December 31st, I'm going to rack up $7,500 in medical bills? Probably not. And even if I do, you have to add the premium, which for me would have been $8,800 in premiums. So even if I do end up spending the $7,500 out of pocket for a medical disaster that occurs in the next 6 months, I'm still in the black because I'm not paying the insurance company's premiums. I can afford the $7,500. I don't see paying the insurance company the $8,800 to fight me for every little dollar. If I have $7,500 in medical bills, here's the good thing about being uninsured. I will pay those bills. I won't have to wait and bait my breath and hold my breath and worry and get agita that the insurance company that I paid $8,800 to is going to deny the claim and I got to pay out of pocket anyway, even though I think it should be applied to my deductible. See, I don't have to deal with that. If I get hurt, God forbid, or I get sick, I just go to the doctor and I write them a check. I don't have to ask permission from an insurance company to go to a specialist. Right now, I'm having some foot problems. If I want to go to a podiatrist, I don't need a referral. I just need to make a phone call and take my checkbook or my credit card. They're going to love me. That's the nice thing. I don't have to ask anybody's permission. I don't have to worry that the podiatrist that I've heard is the best in Lancaster is the one that's not covered under my insurance. It doesn't matter. I can go to any podiatrist in the country because I'm paying cash. I don't have to ask anybody's permission. If, God forbid, I have something more serious, I can go to any specialist in the world. I can get on a plane and go someplace where they're doing research, real research, where they don't worry about stem cells and babies, little could-be babies being killed, where I can actually get real care and I can get experimental treatments. You know why? Because I don't have to ask anybody's permission. And by not having insurance, I already have banked $15,000 this year. The deductible and the premium. $8,800 deductible, $7,500 deductible, $8,800 premium. I got 15 grand to play with. I can go anywhere I want if I get sick. Now, if we had real universal health care, which I do believe is a right for everyone, I am not trying to say that poor people don't deserve health care and that rich people deserve better health care than poor people get. But I'm saying myself and my husband, self-employed, hardworking people, deserve, at the very least, the same health care at the same price that poor people with 7 or 8 kids are getting. We're 2 people. We're not sick. We never go to the doctor. We never go to the ER. And we're paying more so that people who do go, who do use it constantly, can do it cheaper. That's not right either. My husband doesn't work as hard as he's worked to be as successful as he is so that he and I can do without, and someone we've never met can get more, can get what they could too work for if they wanted to. I mean, my husband has a high school diploma, no college. He's self-taught, and he's done pretty good for himself. So if he can do it, so can anybody else. And that's my point. You know, nobody tells anybody they have to have 4, 5, 6, 7 kids. Nobody does that. Nobody says get a minimum wage job. You know, get an education. Work for a better, if you're going to have a family, work to support that family. Don't expect someone you never met to have to do without so that you can have something better than them and they're out there working their asses off. It's not right. It is not right. I don't want more than what I deserve, but I certainly want to pay for my own bills and let everyone else pay for their own bills. And I'm tired of being made to feel guilty because someone with 5 or 6 kids who chose to have those kids is worse off than I am. And somehow it's my responsibility that I send my husband out to work every day so we can pay for them. No, I'm sorry. My husband works every day to take care of our family. Me, our dog Savvy, and himself. And that's how it should be. You know, there are always going to be the haves and the have-nots in this country. There will be the very wealthy who can do anything they want. There will be the very poor who struggle for everything. And there will be people like my husband and I caught in the middle. And in my very, very blatant opinion, it's the ones who can do anything they want, the billionaires, that should be paying for those who are struggling. Not me and my husband. My husband and I can afford to take care of ourselves. Fine. We don't need anybody else. But what we can't afford to do is take care of strangers. We can't afford that. The billionaires up here, they can afford it. So let them do that and let me and my husband work, play, live. Support ourselves. We don't have the fancy accountants like the millionaires do that find all the loopholes. We pay real taxes. And much of our taxes goes to the poor. Those who have either made bad decisions or simply had bad luck. I'm not blaming the poor people for being poor. And I'm certainly very happy for the rich people. But the bottom line is, my husband and I have done pretty well for ourselves. And yet, we still are in a position where we can't do as much as we should be able to. We're not as secure as we should be because we have to sit and pay for those less fortunate. And that should not be our responsibility, us middle people. It should be the people up here, the millionaires, the billionaires, the Trump and his buddies. They should be paying, not for me. I don't need anybody's help. In fact, I would be horribly embarrassed if my husband or I ever ended up on a government assistance program, on welfare, or food stamps. I would be horrified. But these people up here are the ones who should be paying for those down there. I don't need their money. But I can't afford to support these people. Okay? That's just the bottom line. My husband and I do not have children. One of the reasons is I didn't want to be pregnant. I don't want children. Neither one of us wanted children. But the real bottom line is, even if we had wanted them, we know we couldn't afford them. Not if my husband wanted to be self-employed. Just couldn't do it. I would not raise my children with that kind of insecurity, not knowing how much money's coming in every year, because it can fluctuate when you're self-employed. My husband and I, we can deal with that without going on welfare, without going on unemployment, without taking any of our neighbors' money to support ourselves. We find a way. You put kids in the mix, it's a little harder. But we chose not to have children. And it's not a hard choice. It's not hard not to have children. It really isn't. I managed to be not pregnant for 30 years. It can be done. Trust me. Birth control works. And I'll tell you, birth control, whatever you have to pay for it, if your employer won't cover it, is cheaper than having kids. Birth control is well worth your money if you think you won't be able to support your kids. And again, that's something I always say. If you're going to become a parent, and I'm going to do a show about this next week, how could you possibly choose to become a parent and then say, I can't feed my children? I don't have money for food. I need the school to feed my kids. Over the summer, I need charities to feed my kids. How could you even do it? That in itself is a poster for birth control. If you can't afford to feed your kids, 1-800-BIRTH-CONTROL. But some people just think having kids is a right, like anything else. They think it's a right instead of the privilege that it actually is. And it's a shame. Because I'll tell you one thing your kids will remember, that they were hungry, that they went to bed hungry. They're going to remember that. And anyway, that's another show. I don't want to get off topic. But yeah, Obamacare was a lie. And it's the one thing that I do agree with Donald Trump on. Everything Trump has said about Obamacare is true. The premiums have gone sky high. The choices have gone way low. And people like my husband and I end up with the short end of the stick, paying for crap insurance, paying too much for it, so that people that make less money than us, not that they work less than us, but they make less money, they have chosen to have children they can't afford, that they get the same exact insurance at a cheaper price on our dime. Our premiums are paying for them. And that's when I decided that I was going to pick up my toys and go home this year. Since all of the good insurance policies that we've had, and we've had a couple in the past, I'd say 10 years, we've had maybe 2 that we really liked. And every year, your policy's been canceled. Not because we did anything wrong, because we never filed a claim, but because other people, the sick people, the people who go to the emergency room every time they get a sore throat, or they, hurt themselves a little bit. Ooh, gotta get stitches or gotta get antiseptic on there. Don't want to get an infection. Someone spikes a fever, run to the ER, run to the doctor. That's why our policies were canceled. Not because of anything we did, because of what others on the same policy, probably paying less in premiums, what they did. And the insurance companies said, we're losing money. Can't do it anymore. So this year I said, well, you know what? I'm not going to pay for something I'm never going to use. So just like the insurance companies, Paula Luciano picked up her toys and went home. And I feel more free than I ever did. I'm down here in Maryland. Most of the insurance policies that are available on the exchange or even in Pennsylvania will not cover you if you go to Maryland. They wouldn't cover me here anyway. And I'm here 6 months. Why would I even think about paying for something that half the year I can't use? It's like buying a car. And you're paying $50,000 for this big-ass car and you only use it 6 months out of the year. Why would you do that? That's ridiculous. Would you buy a television that you can only use 6 months out of the year? Would you buy a washing machine that only works 6 months out of the year? I doubt it. So why would I buy an insurance policy that won't work 6 months out of the year? I won't. And I didn't. And if I get hurt, God forbid, or I get sick and I'm here in Maryland, I can go anywhere I want with my trusty little checkbook. And they will love me because they won't have to go to their billing department. They won't have to worry about my insurance denying anything. I'll get my service and I will pay for it. Old school. Maybe that's what we need to go back to. Maybe we need doctors to start charging reasonable rates instead of worrying about what percentage the insurance will pay. Go back to charging $50 for an office visit. Go back to charging $20 for a box of birth control pills. Maybe we can put the insurance companies out of business just by working together, because it's the insurance companies that jack up the prices. It's the pharmaceutical companies that jack up the prices. Because the doctors need to make a living. And when the insurance companies refuse to pay them what they're actually worth, it makes the prices go up because they know they're not going to get their full price anyway. If a doctor sends an insurance company a bill for $100, which would be a fair bill, the insurance company will pay them $35, which is not a fair price for their service. So the doctors jack it up to $300 for a visit, and the insurance pays $150, which is probably what the visit was actually worth. Why do we need an insurance company to tell us what a doctor's visit is worth? Why not have a doctor say, you pay me cash today, it's $150. Old school. No computerized bills, no dealing with insurance companies, no fighting with an insurance company because you say it's covered and they say it's not. No more loopholes. Just good old-fashioned consumer business. Go to the doctor, you get your checkup, you pay when you leave. A fair price. And everybody walks away happy. What do you guys think? Let me know. Political Paula, out.